Hello, NCLEX Crusaders. How are you? Let me know if you can hear me. Let me know if you can see the presentation. Welcome everyone that is joining us on YouTube, on Facebook, on TikTok. Welcome to our NCLEX training, NCLEX review on EKG interpretation. If you can hear me, if you can see my presentation, comment in the comment section. Thank you. All right. Very good. Perfect. Marvin, you can hear me. Thank you. Welcome. Do you have one-to-one tutoring? No, I do not have one-to-one tutoring at the moment. But thank you for joining us. Anyway, okay. You can hear me, Victoria, Didi. Very good. All right. Well, let's begin. Let's begin today's training. We are on day 4 of this EKG series, where I have been teaching you for 4 days, including today, how to interpret EKG questions on the NCLEX. EKG is one of those topics that you can see a lot of questions and you can see no questions. It all depends on what you get on your exam. We've had students that have taken the NCLEX and basically have informed us that they received 10 EKG questions the day of their exam. So imagine that. Imagine if that's one of you, that you are preparing for the NCLEX and you get 10 EKG questions and you do not know how to answer those questions. That will be devastating for your exam. So if you're ready to begin today's training, make sure you leave us a like, follow us on our social media, and if you are not able to see this, the best way I've tried to share here on TikTok as well, you can join us also on our YouTube channel where it's a little bit bigger. So if you missed day 1, okay, make sure you go back to day 1. It's very important that you don't miss day 1, day 2, and day 3, because this is a series. You can see it on our YouTube channel. Basically, on day 1, I talked a little bit about the nomenclature of EKG interpretation. What is the P wave? What is the PR interval? What is the QRS? What is the QT interval? All this very important information that you need to know in order to interpret an EKG good. So make sure you go back and you see day 1, 2, and 3. So basically, today we're going to be focusing on some questions that I want to share with you so you can get an idea of how you will see these questions relating to EKG on the NCLEX. Okay, so if you're ready, let's begin. Welcome to day 4, Master NCLEX EKG series, and today we're going to be talking about some interesting questions that you need to know, because you can definitely see it the day of your exam. So welcome once again. Here is an EKG strip. I want you to use what you have been learning for the past few days. I want you to analyze this EKG. Let me see if I can share it here as well. There we go. There you go. Okay, very good. Let me put the EKG strip here as well. All right, I think we can see it there. As you analyze this EKG, and we use basically the 5 steps of EKG interpretation, remember that the first step is to identify if the strip you have in front of you is regular or irregular. If you look at the R to R interval and you count the amount of small squares or big squares, you will see if it's regular or not. For example, if we look at this strip closer and we measure from this R to this R, from the first R to the second R, you're going to see that you have about 5 big squares and then 3 small squares on the right side and 2 small squares on the left side. And if we look at the second to third R to R interval, you're going to see that you have the same amount of big squares in small squares. You can have a difference of 1 plus, 1 minus, and that is okay. But you're going to see that it has the same distance between each R to R. When that happens, you have a regular rhythm. Then you have to identify what is the heart rate. And I showed you that you can find the heart rate by counting the QRS complexes in a strip and multiplying them by 10. So for example, we can see here on this strip 1, 2, 3, 4, and 5 QRS complexes. There is a method that you can use to calculate the heart rate, and it's very easy. Count the amount of QRS complexes in a 6-second strip and multiply it by 10. So if you do that with this strip, what do you think is the approximate, the approximate heart rate? What do you think? If we count 5 and we multiply by 10, well, that's not too hard, right? The heart rate is approximately 50 beats per minute. So why is that important? Well, we have a regular rhythm, but the heart rate is less than 60. So I know that this is not normal sinus rhythm. I know that this is not sinus tachycardia because the heart rate is below 60. So we use step number 1. We use step number 2. Now let's go to step number 3. What is the PR interval? The PR interval in this scenario is completely normal. Remember, the PR interval is between 0.12 seconds and 0.20 seconds. If you measure on each PRI, you're going to see that the PR interval is normal between 0.12 and 0.20. Very good. Now, we see the rhythm is regular, the heart rate is less than 60, the PR interval is normal and constant, which tells you that you do not have a heart block. So now we know that it's not sinus tachycardia, it's not normal sinus rhythm, and it's not any type of heart block because the PR interval is normal and there is a P and a QRS that it is constant. So what do you have? If everything is normal with the exception of the heart rate, if the rhythm is regular, the heart rate is less than 60, the PR interval is normal, the QRS complex is normal, and there is a P for every QRS, you are in front of a sinus bradycardia. This is important because on the NCLEX, they can give you a scenario and they will put an EKG strip mixed with a question. And you need to identify what that strip is saying. For example, how will you see this on, let's say, on an NCLEX question? So let's go to this question here that states, the client is exhibiting the strip that I just showed you, which is sinus bradycardia. The client is exhibiting sinus bradycardia, is complaining of syncope and weakness, and has a blood pressure of 90/60, which collaborative treatment should the nurse anticipate being implemented? This is a very tricky question. If you're not careful, you can make a big mistake here. Now, those of you that are watching this live transmission, what do you think is the answer? 1, 2, 3, 4. Comment in the comment section what you think the answer is. I want to know. And remember, share this video, share this live with others so other nurses around the world can come and join us and prepare effectively to pass the NCLEX. So what is the answer? Let me see. This live is too quiet. I don't see a lot of comments here yet. Oh, here we go. I see answer number 2. Okay. Answer number 3. All right. Anybody else? Answer number 2. Okay, Mr. Garcia, I am between answer 2 and 3. Very good. So, if you're stuck in between 2 answers, the next step is very important. Because how many of you can agree that most of the time you're stuck in between 2 answers and you're like, which one is it? Is it 2? Is it 3? And you're stuck in between 2 answers, and most of the time you select the incorrect answer. The reason why that happens is that you're failing to use the process of elimination correctly. I see, you see, I'm not making this up. I see here, I always choose the wrong answer. All right, well, let's see. What answer? Which collaborative treatment should the nurse anticipate being implemented? Well, let's use the process of elimination. There is a keyword that says here, collaborative treatment. In other words, if I see answers that are independent nursing actions, I can eliminate, because the answer that the NCLEX wants me to select is an answer that is collaborative. So for example, those of you that thought or were debating in between answer 2 and answer 3, you can eliminate answer 2. Why? It's not that it is wrong. It's not that this answer is wrong, because assessing the cardiovascular status on a patient that is having syncope episodes and weakness and sinus bradycardia is a good intervention. However, is an independent nursing action, not a collaborative intervention. So what is the difference between an independent nursing action and a collaborative intervention? An independent nursing action is an action that you as a nurse can do without a doctor's order. You can make the decision to do that intervention. And a collaborative treatment or a collaborative intervention is one that you are collaborating with other staff members, or that you need a doctor's order. For example, collaborating with the pharmacy, collaborating with an LPN, collaborating with the UAP. This is very important, because something as simple as this can, not knowing it, can make you select the incorrect answer. For example, those of you that thought answer number 2 was the correct answer, you made a mistake. But if you would have known this strategy, understanding the difference between a collaborative and independent nursing action, you would have not making that mistake. So answer 2 is eliminated. We are left with answer 1, 3, and 4. How can we continue using the process of elimination to get to the correct answer? For example, answer number 4, we can eliminate. Why? Answer number 4 says, obtain a permit to synchronize or for synchronized cardioversion. Synchronized cardioversion. Well, what do we know about synchronized cardioversion? We use synchronized cardioversion not for bradycardia. We use that for conditions such as, let's say, unstable sinus tachycardia or patients that have supraventricular tachycardia. But we do not use synchronized cardioversion for bradycardic patients. So answer number 4 is eliminated. All right, we're getting there. We are getting there. I see here also, Professor, ventricular tachycardia with pulse. Okay, we're going to talk about that in the next few trainings. So good job. So now we're left with 1 and 3. Do I administer a thrombolytic medication, or do I prepare for insertion of a pacemaker? Well, let's analyze it. Does administering a thrombolytic make sense in this condition? What is my patient's problem? My patient's problem is sinus bradycardia. So administering a thrombolytic medication does not make sense. I can eliminate answer number 1. So what does make sense? Answer number 3 makes sense, preparing for insertion of a pacemaker. Why? Because patient that has sinus bradycardia, symptomatic sinus bradycardia, that do not respond to other treatment can definitely be a candidate for a pacemaker. Now, is this going to be my first action to take normally? Probably not. But in this scenario, the way it was presented to me is the only answer that makes sense. Number 1 doesn't make sense. Number 2 is not the answer because that's an independent nursing action. Number 4 is incorrect because that is for another condition such as SVT, ventricular tachycardia with pulse, but not for sinus bradycardia. Okay? So what are we doing here? Or what am I trying to do? I'm trying to teach you how to think critically. See, that is the key to passing the NCLEX. The key to passing the NCLEX is critical thinking, because they're going to give you scenarios and answers that are difficult to select in between those answers. And if you don't have critical thinking, you're probably going to make a mistake. So let's continue with sinus bradycardia. What is the nursing intervention? ABCs is very important. Maintaining a patent airway. Oxygen if the patient is hypoxemic. Most of the time, when you have sinus bradycardia, look at the oxygen. Most times that there is a relationship with hypoxemia and sometimes having a patient with sinus bradycardia. So very important to maintain a patent airway. Very important to administer oxygen if the patient is hypoxemic. Very important to continue monitoring with a cardiac monitor, but also checking the blood pressure. We have to check how is my patient hemodynamically speaking. What is the O2 saturation? If the patient doesn't have an IV access, insert an IV to administer medication, to give fluids. Also, performing a 12-lead EKG to get a bigger picture of what is going on. It's very important whenever you have a patient that the monitor states or says that the patient has sinus bradycardia. It's very important to determine if the patient has symptoms or not. And why is that important? Well, because you can have patients like athletes, patient that, they work out frequently, in good shape. Well, those patients sometimes can develop sinus bradycardia completely asymptomatic, and there's no intervention. All you have to do is continue to monitor. But if the patient is symptomatic, if the patient has hemodynamic instability, then there are actions that we need to take as nurses. What do you mean, Professor, by hemodynamic instability? What does that mean? Well, basically, it will be a patient that has sinus bradycardia but has hypotension, acute altered mental status, signs of shock, ischemic chest discomfort, acute heart failure. That is hemodynamic instability. So, once again, if a patient has sinus bradycardia, you have to do an assessment, determine if the patient is symptomatic or not. And if the patient is symptomatic, there's usually interventions that you have to perform. It can either be pharmacological interventions or non-pharmacological interventions. When we talk about a pharmacological intervention, we're talking about medications such as atropine, dopamine, epinephrine. This medication will help patients with sinus bradycardia. And then we also have the non-pharmacological intervention, which is considering an expert consultation, a cardiologist, or starting transvenous pacing. So it's very important to understand how to treat these conditions. It's not only important to understand the pathophysiology, but also understand as a nurse, what can you do? Because calling the doctor, calling the cardiologist is probably not going to be the answer. What can you do to help the patient with the patient's condition? So let's go to another scenario. Here it is. So in this scenario, in this EKG strip, we see a completely different condition. So if you look at this EKG strip, at this 6-second EKG strip, what do you recognize this EKG strip as? What is going on here? Can you tell? What is going on here? Let's see who's paying attention. Use the 5 steps of EKG interpretation that I showed you day 1. Okay, I see some of you saying sinus tachycardia. Okay, well, let's confirm that. Let's see if it's true, if it's sinus tachycardia. Let's do the 5 steps. So number 1, is this a regular rhythm? Yes, it's a regular rhythm. What is the heart rate? Is it greater than 100? Let's count. Let's count the amount of QRS complex and multiply by 10. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 13 times 10 is 130. So my patient's heart rate is 130 beats per minute. So it's greater than 100. The rhythm is regular. The PR interval is completely normal. The QRS interval is normal. And there is a P for every QRS. So What do we know is a condition that the rhythm is regular, the heart rate is greater than 100, and the PRI and the QRS is completely normal. We have sinus tachycardia. Okay, now let's apply it to an NCLEX question. Okay, so let's put it in the NCLEX world. So the question is, the client who is 1 day post-operative coronary artery bypass surgery is exhibiting sinus tachycardia. Which intervention should the nurse implement now? What should be the first intervention? Well, we have an assessment, assessing the apical heart rate. We have calling the cardiac surgeon, preparing the client for synchronized cardioversion, and determine if the client is having pain. Now, what do you think is the answer? What do you think is the answer now? Okay, I see Pedroso, answer 4. Okay, anybody else? Okay, I see some of you selecting answer number 2, calling the cardiac surgeon. Okay, I see some of you selecting answer 3, prepare the client for synchronized cardioversion. Wow. You see how interesting these questions can get? Is 1 wrong? No. Is number 2 wrong? No. Is number 3 wrong? Not necessarily. Is number 4 wrong? Not really. So what do? All the answers seem to be kind of okay. So what am I going to implement? So there is a strategy. There is a critical thinking that you can use here. For example, the first one that I can eliminate is answer number 2. Why? Call the cardiac surgeon. Well, that is important. But is there an answer? Is there something that I can do? Is there something I can do to assess or to treat the problem before I call the doctor? It doesn't mean that calling the doctor is wrong. It just means that it's not my priority. It's not my first answer. So answer number 2, I can eliminate. Now I'm left with 1, 3, and 4. What is the answer now? What is the next answer that I can eliminate? Well, for example, answer number 3 is a little bit invasive at this time. Thinking about synchronized cardioversion, that's a little bit too much. Because synchronized cardioversion, we don't usually do it for sinus tachycardia unless the patient is very unstable, and other interventions have not been effective. But also, remember this is very important in front of sinus tachycardia, that you try to determine the underlying reason of why this tachycardia is happening. Is it because of pain? Is it because of fever? What's the problem? Is it because of anxiety? So think about it. If you have a patient that is very anxious and the heart rate is 125, which is sinus tachycardia, are you going to cardiovert the patient? No, that doesn't make any sense because it's too strong, too much of an invasive answer for a client that might just be anxious. So it's very important with sinus tachycardia to determine the underlying reason. If the problem is fever and the patient has tachycardia because of the fever, give an antipyretic drug. If the problem is pain, give a medication for pain. If the patient is anxious and has tachycardia because of anxiety, give an anxiolytic. So we usually, in those conditions, do not treat the heart per se. We treat the underlying reason. So we can eliminate answer number 3. So we are left with answer 1 and answer 4. What is the correct answer between these two answers? Both answers are assessment. Both answers assess the patient. How do I select the correct one? Well, let's look at the stem of the question. What is the problem? The patient had surgery 1 day ago. So I ask you, could it be that maybe the problem is pain? And because of the pain, the patient has tachycardia? So answer number 4 validates the scenario and helps me determine if the patient has pain. If the patient has pain, which makes a lot of sense, 1 day post-op, then probably what I need to do is give pain medication. Is answer number 1 wrong? No, but doesn't necessarily validate the probable reason or the probable condition that the patient is experiencing that is causing tachycardia. So, in front of sinus tachycardia, we have to remember what we just talked about sinus bradycardia. Airway, breathing, circulation, IV access, 12 lead EKG, but it's very important to identify the underlying condition. Fever, anxiety, pain, electrolyte imbalance, hypoxia, heart failure. What's the problem? Then treat that problem. If the patient has stable tachyarrhythmia, then the treatment can be vagal maneuvers, Valsalva maneuver, carotid sinus massage, or we can even try pharmacological interventions such as beta blockers and calcium channel blockers. But once again, if you see that the problem is not really a problem with the heart, is another condition like fever, like pain, then treat that first and see if there is a change in the heart rate. Okay? Very good. So what do you think so far about today's training? What do you think about that? All right, sounds good. Okay, I'm going to see you again next Friday, and we'll continue to review other scenarios, continue to improve your critical thinking and EKG interpretation. So I'm going to see you next Friday. You can join us on YouTube. You can join us here on TikTok. I am here to help you and guide you. Thank you for all the wonderful comments in the comment section. I see a few of you commenting that you passed the NCLEX. Congratulations. Thank you for coming back and letting me know. God bless you all. I'll see you on the next training. Bye-bye.